Good afternoon, everybody, and welcome to this session of the University of Chicago Alumni Weekend UnCommon Core. We're very honored and privileged today to have a very enthusiastic leader in the family medicine and medical community health forefront with us, Dr. Kohar Jones. I'd just like to slip in for 30 seconds before I introduce her and her credentials properly, that this session is being co-sponsored by my alumni affinity group, the Chicago Women's Alliance. The Chicago Women's Alliance was founded 6 years ago by several alumni. Many of them were from the business school. And what we do is we have like-minded women on our board, and what we actually do something very similar to this presentation. We invite women that are either on the faculty of the university or affiliated with the university to give presentations. Then we have a very nice dinner and networking event. After that, we do that several times a year. In addition to that, we have a networking event at a very nice venue in the Chicago area where we have dinner for primarily University of Chicago women, but anybody is welcome to come, including like-minded gentlemen. And this year we're doing something new. We're going to have, for those of you from the Chicago area, you'd be excited to learn that we're having a tour and presentation of the Lurie Hospital. That's kind of big news, certainly in the medical community and in the Chicago area. And one of our board members who was a social worker at Children's Memorial and now at Lurie is going to be coordinating that. She's actually in the audience, Hazel Vespa, going through her purse. So now we're going to talk about Dr. Jones, and now I need my notes because she's been here since she joined the faculty in 2008, but she's already doing so many things that I kind of need my notes to keep track of them all. Dr. Jones is, first and foremost, her training has been in family medicine. She received both her bachelor's degree and her medical degree from Yale University, and then went on to do her residency in family medicine at Brown University. She's currently an assistant clinical professor in the Pritzker School of Medicine. She's a very hands-on, very leadership-oriented kind of person, and she's already heading a lot of significant community medical education projects in the Chicago area, and I'll try to get through all of them. She spends time between her spends time at her clinical practice at the federally funded Chicago Family Health Center. And at the Pritzker School of Medicine, she co-directs the community health track for Pritzker Scholarship in Directory Curriculum. She's a scholar with the National Health Service Corporation, and she's with a community physician with the Urban Health Initiative, as well as the Repayment to Alumni in Community Health program that increases healthcare capacity and provides incentives for highly qualified family care medical practitioners to go to underserved areas. Dr. Jones also co-directs the Pritzker School of Medicine Service Learning elective that returns fourth-year medical students to clinics for continuing their education where they were originally interns when they began their medical training. And through this, the acronym of this program is SERVE. She is providing the next generation of community-engaged family healthcare physicians. Her scholarship focus on the structural and structural determinants of the current status of healthcare and health disparities in this country. And I also noticed that she is also knowledgeable on the ethics of biomedical research, which is just a whole nother constellation of concerns and policies. And that in and of itself, I know, is a huge area. And she's also interested in policies for government with respect to community health, family health care, and students pursuing medical electives actually in the community. She's also a member of the Academy of Family Physicians and serves on the National Clinical Advisory Board for Health Leads. So as you can see, this is a very unique opportunity for all of you in the audience to learn from an extremely qualified person what kind of medical education and community health potential there is in the Chicago area as well as nationally. So without further ado, I'm very pleased and honored to present Dr. Jones.
Thank you so much, and thank you to you all for coming to this session today to learn about the community education opportunities for the Pritzker School of Medicine students. It's a beautiful day outside, and it's nice to see the commitment and the passion that brings you here to join us today. As you've heard, I'm Dr. Jones, family physician, Director of Community Health and Service Learning for the Pritzker School of Medicine with the support of the Urban Health Initiative. And in that capacity, I bring together the resources of the Pritzker School of Medicine with the resources of the community, creating a partnership that brings the medical students into closer connections with the community to meet the community health needs. Every academic medical center rests on the tripartite mission of medical care, research, and education. And the University of Chicago Medicine is unique in its commitment to bringing students into the community and the community to the students. I'll be telling you about some of the different programs and opportunities classes that we have available today. I'm going to start, though, by talking about what is community health. When we talk about health, when we talk about medicine, what does it mean to be healthy? Where do we put our energies as a society, as a medical center? So I love this allegory of the cliff that was put together by another Dr. Jones, Kohar Jones, who does a lot of work with the CDC on health disparities. And this allegory of the cliff provides a very clear picture, in my mind, of the different levels of health intervention. So, community health. Imagine, if you will, a cliff. And imagine someone walking along the top of the cliff, la-di-da, enjoying a beautiful June afternoon, and checking out the view, checking out the sky, getting closer and closer to the edge of the cliff. Oops, tripping, oops, falling, oops, hitting the bottom. So what are we going to do? Someone's just fallen over the edge of the cliff. What do we do? I'll call 911. I think I heard a voice from the audience mouthing that.
Obviously, the first thing you do is give them first aid, but you can't just save them, but you got to keep that cliff safe.
Yes, you do. The goal is to keep the cliff safe. Whether that means putting a safety net, I mean, you can put the safety net down halfway down the cliff to catch them before they hit bottom. You can put the fence at the edge of the cliff to keep them from getting pushed over the edge, tripping over the edge. Sometimes, though, you have so many people up against the edge of the cliff that you end up, it's like a British football match, a soccer match, when they get shoved over the edge. There's just too many people. So then thinking of ways to get them away from the edge of the cliff so they don't get to that dangerous spot in the first place. These different points of intervention correlate to the different levels of intervention in a medical healthcare system. There's the medical care and tertiary prevention that we do a fantastic job with University of Chicago Medicine at the academic medical centers where most physicians are trained around the states. The trauma center where you bring the folks after they've already fallen over the edge of the cliff. The secondary prevention programs are this, when you try to keep people, so tertiary care, you try to keep people from dying. Secondary prevention, you try to, they already have a disease, but you try to keep it from getting worse. If it's diabetes, they already have the problems with their eyes, they see an eye doctor. They already have the problems with their kidneys, they see a kidney doctor. They already have the disease, but they're trying to keep from ending up blind and losing their limbs to the amputations. as it gets worse. Primary prevention is trying to catch it early, trying to catch the disease early. You're trying to prevent it from happening in the first place. With the diabetes, doing the yearly checkups, checking the sugars each year, trying to catch it when it's pre-diabetes, so that with a little bit of lifestyle changes plus the medicines, you can prevent it from getting worse. The primary care that's provided by the internists, the pediatricians, the family physicians in the community. But we talked just now about lifestyle changes and thinking about those social determinants of health. With the diabetes, if you have a place to go and exercise, if you have healthy food that you can go and buy in a grocery store, if you have communities where you get together with your family and cook healthy meals and sit down to eat it together, this has nothing to do with the medical system. It's the social determinants of health. And this is where wellness can come from. Trying to shift a healthcare system away from the sick care system of the ambulance up to the healthcare system of creating a healthy community, a healthy environment to live in, is the goal of community health. How many of you have seen the socio-ecological model of health before, this graph? I see a lot of hands in the audience. That's great. Dare I call on one of you to explain it, or shall I? I'll go ahead. I saw some brave souls ready to speak, but the idea of what does it mean to be sick? What does it take to create wellness or sickness? Within an individual, we think of our hematologists dealing with blood, dealing with cancer, the nephrologist dealing with the kidneys. There's these things inside of us, the genes and the predispositions interacting with the environmental factors around us that make us healthy or sick. And those environmental factors, it's the individual lifestyle factors, what we eat, how we exercise. And what we eat and how we exercise may be connected to our social and community networks. Is it safe to go outside? Or do we have people to walk with us to support us in eating our healthy foods? Do we have places to go to in the community? Are there gyms? Are there sidewalks? Are there grocery stores? Is there an environment around us that can support us to be healthy? Clean water, clean homes, no cockroaches, no mice. Beginning to think outside of the medical center and into the ways that people live to think of how to be well. Thinking of how that relates to disparities also. That there's disparities in access to care based on education, jobs, insurance. There's disparities of strength of care and disparities of opportunity in the lives that folks lead. Okay, so what does this all have to do with Pritzker? There are tons of places within the Pritzker curriculum for the medical students to learn not only about the biological basis of disease, but also about the social basis of disease, the structures of our societies that support or detract from health. It begins with the health disparities course as students come in to the medical center. As they go through first year, there's a longitudinal curriculum where they can go into community health centers or within University of Chicago Medicine, but working with Southside Healthcare Collaborative groups in order to follow community physicians to see the community aspects of health. There is the scholarship and discovery track. The scholarship and discovery, every Pritzker student now is required to do a scholarly project in one of 7 different tracks, whether that's medical education or quality improvement, basic sciences, clinical sciences, community health, global health. within community health, there's an elective in the spring of first year that the students can take, and then they have multiple opportunities for pursuing community engaged scholarship. One of those opportunities is the Summer Service Partnership, a summer service learning opportunity that brings together, well, I'll tell you more about it. Right now I'll just say Summer Service Partnership. It exists. You will hear more. There's also, as they go through their first year, tons of different opportunities of different student-run free clinics or community education outreach programs. There's a block at the end of second year where they can engage, more fully delve into their scholarship, the community engaged scholarship, whether that's community-based participatory research or deepening their engagement with service learning. In their third year, they return to an additional requirement. All of this is optional. Students can opt in or opt out. After healthcare disparities, which everyone does, then folks can self-select where they want to go. In third year, as the students go through their family medicine clerkship, there's a requirement once again to get into the community, to participate in organizations, and to really connect. And then at the fourth year, there's an opportunity through the fourth year service learning elective to get back into the student-run free clinics and the community education outreach organizations that they volunteered with first year. Okay. So with scholarship and discovery, I talked about community-based participatory research as one opportunity that students can do. There's lots of different faculty doing fascinating work in the community. With the translational medicine of bringing research from bench to bedside, then from bedside to community, thinking of how do you translate findings into health for populations. Looking at that process of bringing information into the community is the final step. One such group of researchers doing research is Marshall Chin in the Department of Internal Medicine with Monica Peak with their Southside Diabetes Project. It's great. You guys can check out southsidediabetes.org. And they're working closely with different community health centers on the South Side. And then students have an opportunity to join them in the research. One student did his work assessing how the leaders of diabetes empowerment programs felt about the work that they did. The work that I do mostly through the Pritzker School of Medicine is in supporting the service learning. And the idea of service learning is a specific form of experiential education where some people learn by doing, some people learn by reading, some people learn by listening. And for those who learn by doing, trying to create experiences of learning where the students are responding to community-defined health needs, and the doing that they're doing is service to meet the community-defined needs, to work together in partnership, and an iterative process of preparing for an experience, having the service experience, thinking about what that experience was, what they learned from it, what it meant, how it fit into a larger perspective, and then acting on what they have learned. And when they act, preparing to serve, then reflecting on what they've learned, it's a continual process of deepening engagement with the community and growing into their own role as citizens. So service opportunities at Pritzker, tons of them. Whether it's a day of service, volunteering in the student-run free clinics, the student educational outreach programs, Pritzker Community Service Fellowship, a mentoring group to support students, connecting them with residents, attendings, the Summer Service Partnership, the Serve Elective, the resident free clinics, lots of different opportunities. What do folks do on a day of service? This is a specific Saturday, and actually, maybe I'll have Tom talk about some of the days of service and some of the things that have been done. Had asked him to talk about his work with the Maria Shelter, and I'm realizing now that I have some pictures up here about the day of service through Maria Shelter. So if you could come on up and talk a little bit about the day of service and then going on to the experience with student-run free clinics. Okay? Mm-hmm.
Hi, everybody. Thanks for coming. My name is Tom Corey, like Dr. Jones said. I'm a rising third-year medical student. I can start talking about the days of service. This is at Maria Shelter. That's my friend Chad. So just some background. I'll actually begin by talking about Maria Shelter. It's one of the free clinics that Dr. Jones mentioned. When I say free clinic, there's a few at Pritzker. There's NLVS on the north side, a new one, Iman, on the southwest side, Maria Shelter in Inglewood, Washington Park in Washington Park, CHC in Ukrainian Village, I think. I think that's all of them. We call it free clinics because people can come there and get free health care, free medicines. Our role as medical students is we obtain histories, practice physicals. It's really more than that, though. It's like Dr. Jones alluded to, it's an opportunity to get out in the community, to meet people, to see what the predominant health needs are. I mean, yeah, we get to practice, like I said, practice our skills, which is really important, but I think looking back, first year when I did do these things, the big things I took from it were meeting people, seeing what kind of health needs were out there, things like that. So this is Maria Shelter. I was also a treasurer there. Maria Shelter is completely student-run. Just a little background on it. It started, I think, in either the 80s or the 90s as a shelter for women who were fleeing domestic violence, physical, sexual, anything like that. And it's also for their children as well. It's a safe zone for them. It's only women and their children allowed. And it's a place where they can get together, get back on their feet, where they're supported after going through these horrible things that they went through. And every Wednesday night, there's clinic night. And attending volunteers and comes from the University of Chicago. Medical students are there, and like I said, we obtain the history and talk to the patients, and then the attending comes in and does actually figures out what's wrong. We just try to. And then, yeah, and it's a really great learning experience. It was probably the most rewarding thing I did first year, definitely. You know, it's a way to kind of keep things in perspective. You just study all the time. I think there's some doctors out there, physicians, you guys know what it's like. It really keeps things in perspective, which was great. And to parlay that into day of service, as Dr. Jones said, it's a quarterly day, so once every few months on a Saturday, we spend a half day doing service. A lot of places throughout the community, almost always on the south side. And I think it's unique. When I was growing up, community service was, you know, we thought that something needed to be done, so we'd go and do it. It came from us, you know, whatever school I was a part of or group. For days of service, we really tried to engage with the community. We asked them, what do you need from us? Like, we're here to help you guys. You know, we don't want to come with the ideas. We want to hear from you. And we try to keep continuity with different sites. There's probably 3 or 4 we go back to a lot, Maria Shelter being one, Epic Academy on the south side. We also accept new sites too. But we'll call them and say, you know, we have 10, 15-ish people. What would you like us to do? Anything you guys want. A lot of it's manual labor stuff, but it can be anything. Here is at Maria Shelter, we're cleaning up a room. I can't remember what this was used for. It might have been more housing for women who were coming in, just more free space. But it's really a great day, much like the free clinics, you know, get out there and see what's out there. It's very easy to be caught in the bubble of Hyde Park. As I said, Maria Shelter's in Inglewood. And it's great just to see, you know, what else is out there. There's a lot happening in these communities, even though the newspapers might say, you know, there's nothing going on. I've learned so much from meeting people out there, just from hearing about everything that's happening. And the days of service definitely are a great way to do that. After we do the service, like I said, it's usually about a half day. We come back to the U of C, and there's usually food, and we sit back and reflect on what we did. And it's really a great way to, you know, hear different perspectives. You know, maybe some people in the group came from, you know, similar circumstances to some of the things we might have seen. Maybe some didn't, but everyone usually has a unique perspective that really helps further, you know, our reflection on what happened that day. But yeah, I'll be happy to answer more questions about the clinics and the days of service in the Q&A. But thank you.
Thank you, Tom. And for this day, of this particular day of service, it was a clinic room that was, or not a clinic room, a shelter room that was being turned into a library by the students. So from messy books to books ready to go for the student or for the children living in the shelter, with folks from the shelter and the students coming together. Tom had talked about the, and I should say Tom Corey is the second year, and all of our panelists today are second years, as the third years are in clinics, the fourth years have graduated, and the first years are heading out on vacation. So thank you guys. The 5 student-run free clinics, there had been 4 previously, a new one that got added in this past year, the Iman Clinic for the Inner City Muslim Action Network clinic, where students are helping to staff the clinics on the south side and learning in the process. I should say that part of the idea of service learning is that there is a balance between the service and the learning. It's not about volunteerism, which is, let me give this to you, and it's not about learning purely from books, which is just absorbing the knowledge, or about doing internships where it's about taking the experience without necessarily giving to the community or to the group as much as needed, but to really find that praxis, to really find that balance of how do you harness the energies to learn and to serve in that perfect balance. Okay. In addition to the student-run free clinics, there's a lot of different educational outreach programs. The Adolescent Substance Abuse Program, where medical students go into middle schools to teach them about bringing diseased lungs to say, watch out, this is what can happen if you use. Mission Nutrition, teaching about healthy diet, how to eat, or just how to be healthier. The Southside Science Scholars, started by a first year last year, teaching science to the middle school kids. HipCore, a class teaching about HIV, then bringing that knowledge about HIV, sexually transmitted diseases, into the Chicago public schools. The Health Professions Recruitment Exposure Program. Lots of different possibilities. And then there's the Summer Service Partnership. This is the summer program that was initially envisioned as the alternative to the summer research program for students who wanted more hands-on experience in the community. There are 3 neighborhood teams in Woodlawn, South Chicago, and Greater Grand Crossing, partnered with high schools from each of those neighborhoods. It's a tiered mentoring structure of medical and other professional students working with college students as team leaders for the neighborhood teams. That include 3 high school students from each neighborhood. And as they go through the summer, the goal is to learn about the social determinants of health, to learn to be aware of that, while exploring the assets of the community, thinking of asset-based community development, finding what exists within a community to be leveraged in partnership with the students to promote the health of the communities, to address a specific health topic. The projects have run the gamut from sex ed, teens teaching teens in Woodlawn, working with Melissa Gilliam, who does a lot of work on family planning. She was doing a study on teens teaching teens through social media, and the students of 2010 created videos: where to go in the neighborhood to get condoms, how to use the condom. And today, if you go to YouTube and type up how to use a condom, the Team Woodlawn video pops up on that first page of where to go, the teens teaching teens how to be healthy with the healthy sex. The following year, Team South Chicago, working with students from Epic Academy, addressed the health topic of obesity and came at it with a multi-pronged approach. Excuse me. One high school student created nutrition classes for a middle school summer program. And they put together the materials and then taught. Another student decided to advocate for a kitchen for their public school. There had been no kitchen. Lunch consisted of frozen, half-de-thawed ham and cheese sandwiches. People were skipping lunch, getting hungry, getting quarrelsome by the end of the day. And so they successfully advocated for a kitchen, attending the Chicago public school meetings, saying there's this new obesity grants coming from the federal government with the Affordable Care Act. The money's come to Chicago. Can we have some of that money for our charter school, please? And now they have the kitchen. They have the fresh sandwiches. They have the fresh salad bar, providing the vegetables for the community. As they were thinking about how to address the food desert, they said, well, why don't we have a community garden here? And they worked with the school principal to set up a community garden on the school grounds, setting up a class throughout the school year of, it was a science class, learning about chemistry through soil sampling, biology through growing the plants. And then at one of the spring days of service, the medical students joined the high school students in planting the beds, digging the beds, creating them, planting the plants that had been growing in the high school science class windows, and establishing the community garden that provided some fresh vegetables for the community. I'm going to have Rebecca tell you a little bit about her experience last summer with the Summer Service Partnership.
Hi, my name is Rebecca Harris. I'm another rising third year at Pritzker here at the University of Chicago. And Dr. Jones gave you a really good background on the Summer Service Partnership. Basically, we were all divided up into one of three neighborhoods, all on the south side of Chicago. One is Greater Grand Crossing, another is South Chicago, and I was working in Woodlawn. And each team had 2 medical students, a college student, and 3 high school students from the neighborhood. And what we did is we really explored the community and then explored all of the resources that the community had to offer, and then came up with a community health project based on what we had learned. So when we first started SSP, the first couple of weeks, what we did is we just kind of walked up and down the blocks of Woodlawn and really just got to know the community. We would just go into every church or shop or grocery store that we saw and talk to really anybody that would talk to us about anything that they were doing in the community or what they did, and asked them other people that we could talk to, and just kind of tried to meet as many people in Woodlawn as we could. And that was a really amazing part of the program, and I really enjoyed getting to know the neighborhood. So what we did from there, after we had kind of learned a lot about the community, we sat down and discussed what kind of community health projects our students would really be interested in. And they were all very interested in bullying, because a lot of them had been affected by that in their high school. So we decided to set up a project on bullying. They set up and designed an entire workshop to be held at their school on anti-bullying. And they also had designed some posters and had a poster contest at their school for anti-bullying purposes. So it was really cool to see their projects come into fruition. I think one of the greatest things about SSP is really getting to know the community to the extent that we did. I think meeting people in the community and talking to important people about projects that you're doing can be a really intimidating thing. And it's a really difficult thing to do a lot of the time. But we really were talking to everybody about the things that we were doing, and it was a really great experience for myself and for the high schoolers in that respect. It was really great, the relationships we formed with people in the community, and then also with the people on our team were really amazing. It was really great watching our high schoolers grow and introduce themselves to important people in the community and tell them everything that we were doing. It was really inspiring, and it was really great to see everything that they did. So that's SSP.
Thank you, Rebecca. I have to say it's neat for me to watch each one of the levels of learners grow and learn from each other. At the end of the summer, there's a presentation where the students stand up and share their experiences, and to see the high school students in particular go from being really nervous to being able to stand up there and say, hi, this is who I am, and this is what I did, and this is what we should be doing differently in order to create our healthier communities, was a very powerful thing. As we get to the fourth year, the students have the opportunity to return to the student-run free clinics and the community education outreach programs through the SERVE elective. It can be a challenge to, previously it had been a challenge for the students to engage with the projects. They needed enough credits to graduate. They were in, they were out, they were never sure when they could connect with the organizations that they had led as first and second years. They requested the opportunity to receive credit for continuing their work with the student organizations, and the school decided to grant that. Again, this is unusual among other academic medical centers to support ways to ensure the continuity of engagement of the students with the community. With the projects, or with the program, the elective, there's 8 specific service sessions with monthly reflections where students read articles or attend lectures, whether that's on the ethics of student-run free clinics, thinking of supporting transitions in leadership for the different organizations, thinking of how to be better educators, a medical education one, for the fourth years to support the first and second years in the work that they do in the clinic. They think of what they've learned from that, they reflect on that, and most importantly, they do a project, a guided project, a mentored project, addressing a specific need of the organizations or of the community. And it's been a wide variation of what students choose to do, whether it's creating depression screening in 43 languages for the communities on the north side with New Life Volunteer Services, or whether it is working with teenagers for Teens Teaching Up, where teenagers in the community learned or came together to create a workshop for the medical students, for physicians, on how to effectively communicate with teenagers, finding ways to connect with the community and support that. And so the opportunities to connect continue even after the medical school. The pediatric residency has their continuity clinics in Friend Family Health Center, providing 16,000 visits by their 55 pediatric residents each year. The internal medicine clinic has a new setup in Community Health Center Englewood. With some support from the Urban Health Initiative, they expanded the community health clinic where the undergraduates volunteer on in the Ukrainian village to Englewood, bringing it down closer. There's also opportunities for the students to return after they are done with the repayment for education to alumni and community health. This funding provides students the opportunity to get an additional $40,000 each year when they're trained and come back as community physicians, $40,000 each year for 4 years to provide their care on the South Side. 80% of their time in the clinics, 20% of their time at the university to serve as mentors and leaders for the next generation of community physicians to be trained as they come through. I'm realizing as we went through, when we talked about scholarship and discovery, we didn't go into details about the scholarship and discovery project that Joanna Perdomo is working on. So I'd like to wrap back and allow her to tell you about the research that she's been doing.
Hi, my name is Joanna Perdomo. I'm a second year at Pritzker, and I am part of the Community Health Scholarship and Discovery track that Dr. Jones spoke about earlier. And through our scholarship and discovery program, we are each tasked with taking on a scholarly endeavor, whether that be, work in a lab or work in the hospital doing a quality improvement project. And I chose to do a project that would get me out in the community, which is something that I'm very passionate about, and I had been doing throughout my first 2 years of med school, and I wanted to continue doing in a scholarly way. So I'm working with Dr. Mary Egan, who is in the Department of Family Medicine, and I'm starting a project which just started this past month and will continue through the next 2 years on assessing the cooking, eating, and grocery shopping habits of community members in the South Side. I'm very interested in cooking and nutrition, and I came to Dr. Egan to talk to her about whether it would be possible for my scholarship and discovery project to write a cookbook on healthy, budget-friendly cooking that was relevant to community members in the South Side. And she was in full support of it, which was really exciting and very common of mentors at Pritzker. And together we worked to put together a survey for community members on what they're currently cooking, eating, and grocery shopping for and where they're doing it. And I administered that survey this past month at the Chicago Family Health Center. And from the results of that survey, which showed that people are very interested in cooking, would like a healthy cooking resource, and I also got information about where they shop and visited the grocery stores at which they shop to get an idea of the ingredients and the prices available. And using that information, once I finish my third-year rotations, in fourth year I'm going to come back and actually put together a healthy, budget-friendly cookbook that can be distributed at Chicago Family Health Center and hopefully to other outlets in the community as well. So that's just one example of what I'm doing as part of the community health track, and I have many other fellow students doing really interesting work, from service learning things to things with education groups in the community, and it's really wonderful to be supported in our scholarly pursuits, no matter how different or unconventional they may be. So, thank you.
And do we have time for questions? Yes, I would love to open the floor up to any questions you may have. Yes? I'm sorry, can you repeat? We're working on evaluating the outcomes, and we're looking at different outcomes for the different programs. One of the major goals of the programs is to build the future community health workforce. And the programs were put into place in 2009 was the first year of the summer service partnership. The students who went through that are interns now. So we know that most of them went on to primary care. All except for one went on to primary care. And Tom actually has been working on the program evaluation for the Summer Service Partnership to look at what the outcomes were. Should I have you tell more detail? I think I gave well, let's have you talk about the SSP.
I'd say the preliminary data shows what Dr. Jones said, that the majority of medical students who participated in SSP are going on. They either have gone into primary care specialties or they plan on going into them. We looked at all the different levels. As Dr. Jones said, it's a tiered program: high school students, college students, and medical students. Majority of our high school respondents said that SSP helped them feel prepared to go into college and to succeed in college. For college students, probably the most interesting. Oh, I can talk. Okay. The most interesting piece of data from the college students, I think, was that SSP it did help them feel prepared to continue to succeed in college, but it influenced their career choice. So it seemed to be like a really pivotal moment for them. From first year to second year to third year to fourth year, college students can participate in SSP. And then, as I said, for the medical students, the majority appear or have gone into primary care specialties, and a vast majority of our respondents said that just participating in SSP alone helped them feel more confident in working in medically underserved areas, addressing health issues on a community level.
Mhm.
I just had a quick question about the summer service partnerships, about how many people actually do them. And I wondered, as you kind of enter and go out to the community, and then you're maybe, 8 weeks or whatever it is, do you also simultaneously with the others who are all over the city have kind of an integrated seminar among yourselves as you go? Or is it not until you get into your fourth year that you go back and reflect on the experience? I just wondered, as you were in the process of it, whether you had a formal or informal support system within your program in the school.
Yeah, there definitely was a great support system. Each team was made up of 6 members, so there were 3 teams of 6 people. And every Wednesday we would get together all as a big group. And I know Dr. Jones was in charge of leading a lot of the big group activities, but we did a lot of field trips together, but we also had a lot of like lectures on asset-based mapping, for example, and photo voice, which is like taking pictures of the things that you're observing in the community as a way to report on them, and also learning about blogging and reflections and things like that. So there was also a lot of group time.
Fred Matheson, a question for Dr. Jones. It seems unusual for a school like Chicago to have within the walls, a family medicine program. And I'm wondering if you could tell us how many other schools like Hopkins and Duke and so forth do that, and what kind of support you get from the rest of the school.
Mm-hmm. Great question. They talk about the peer institutions of Pritzker this year is in the top 10. It's school number 8 in the nation for the medical school. And many of the top schools don't have family medicine. They'll have medicine, they'll have pediatrics, they'll have med peds. Not all of them have family medicine. Family medicine at Pritzker began in the early 2000s. It was an initiative through the internal medicine with support from folks in anesthesiology. It was a couple different folks coming together saying, you know what, we really need to support the community, and we need to provide a department that can help to train our students for this. Holly Humphrey has been an incredible support. She's the dean of the medical center. And there's been health disparities, there's been poverty, just the awareness of needing to think about health disparities and needing to think about how to address them have been within the medical center. As they began to look at how to best engage the community, the nascent family medicine department that was very small found more of a foothold with the Urban Health Initiative. They have a community-affiliated physicians program, which is what brought me to the university, where full-time community physicians could have 20% of their time bought back to participate in the academic world of the medical center. And through that Urban Health Initiative, we have many part-time faculty now within the family medicine department. There's no residency program on the south side. The University of Chicago partners with North Shore, and so the family medicine residency through University of Chicago is in the North Shore area. So the University of Chicago faculty focus on teaching the medical students, mentoring the medical students. They provide space in their clinics for longitudinal program for first years to attend multiple sessions to see what life is like as a community physician. They serve as preceptors for the family medicine clerkship, again providing the chance for students to see committed, passionate folks in family medicine. And the numbers of students choosing family medicine have gone up significantly. Our peak was at 11 3 years ago now. We've had maybe I think we had 7 this past year. So these numbers are high compared to our peer institutions. And I think in large part because there are these opportunities to have experiences in the community, to be exposed to what it means to be a community physician and to gain the skills in a stepwise process, to see that there are needs and there are assets and there are partnerships, and they build the skills to be able to respond in an effective way as team leaders for community health. Excuse me. Other questions? Mm-hmm.
I have a question for the last speaker. You mentioned you were working on a cookbook. That sounds fascinating. Are you trying to take into account of what people actually eat? Because different communities will eat different things.
Yeah, absolutely. That was one of the main things that I wanted to learn when I set about to do my research. So this past month when I was doing surveys at the Chicago Family Health Center, I asked a lot of close-ended questions in terms of how people cook their food. Do people feel like they can find fresh foods in the grocery stores? But then I closed every interview with open-ended questions, asking people what they like to cook, and also what do they like to eat, or what would they like to see in a cookbook. And I got a really good sense this way in seeing kind of what the most popular things were about what kind of things people are interested in eating, and learning about, for example, I think chicken was #1 on the list, which I guess that would be maybe anywhere. But people really want to learn how to cook lasagna, which is something I might have not known had I not done this survey. So I was able to get a sense of what people's food preferences are, so I can use that in the creation of the cookbook.
Do you also want to talk about your visits to the neighboring stores?
Oh, sure. Yeah, so in my survey, in interviewing patients, I also asked them where they did their grocery shopping and kept a running list of that. And then I did visits to about 8 or 9 grocery stores in the South Side, and walked around, got a sense of pricing and availability of ingredients, because people very much want budget-friendly recipes. So I wanted to make sure that any ingredients I include are not only available but are also at a reasonable cost. And that was another prong of my work as well. Mm-hmm.
I'd actually like to wrap back to the question about outcomes, and I'm realizing that we talked about SSP outcomes, and I just want to run through the numbers of the different projects as far as we know them. So SSP has been in place since 2009. The first group of students to graduate are now interns. We'll find out how many choose to come back to the community in another 2 years as they finish up the work that they do. Thank you for talking to some of the other aspects of that. For the SERVE elective was implemented in 2010 for a pilot year. From 2011 to 2012, 30 students signed up out of 88. This upcoming year, 35 have signed up. We tried to cap it at a quarter of the class, but we said if people wrote to us saying, please, this is why we want to do it, then we would say yes, and we got up to 35 with the pleases. When we surveyed the students of the 2011 to 2012 year, 95% were planning to continue on with volunteerism, 3/4 planning to continue working in an underserved community, and 2/3 were planning to continue in primary care. These numbers are extremely unusual, very high, and the question will be, was that an anomaly or will that be sustained over time? We just are wrapping up this year, so we don't know what the numbers will be like from this year. For the scholarship and discovery, there's 88 students now in each class, and each year 10 to 11 students have been choosing to enter the community health track, whether the focus is on the community-based participatory research or on the service learning. And of the students who are not in the track, nearly everyone, it was 85% on the ACGME survey, the survey for the medical school accreditation, said that they had participated in the student-run free clinics or had participated in the educational outreach. This past year, the students had asked to incorporate a day of service in the orientation to the school. So as the students are coming in, as soon as they set foot in that first weekend on the campus, part of the campus is extended into the community as they head into the neighborhoods for the service. Mm-hmm.
Is there going to be any examination of the outcomes, health outcomes in the communities? We've talked about the effect on education and student interest, but what about the other side of the equation?
That's a fantastic question, and that's one of those questions that's hard to answer. It's hard enough to answer for the closed community of the students. Was it this that impacted them or that? Was it everything all together? How do you separate it? When you talk about community health, there are so many factors coming together. The question is, which one is the one that makes a difference? There's a couple of different research studies that are happening now on the South Side. The South Side Health and Vitality Studies run by Stacy Lindau with the support of the Urban Health Initiative. Really understanding all the resources on the South Side and figuring out, capturing the data from the health centers through Medicare, Medicaid, trying to understand, once you implement pointing people towards community resources, does that make an impact on their health outcomes? It's a difficult question to ask and answer. The data that they're capturing may help to answer those questions. Southside Diabetes, the Marshall Chin, Monica Peak studies, again, trying to look at, if you train the physicians in community health centers while providing support groups for the patients, while providing exercise classes, is there an impact on the biological markers? Should we be looking at biological markers? Might there be other factors that we should be looking at? And as a university right now, there's a big push towards looking at redefining what we should be looking at when we look at health as we think of urban health, creating new methods to research and new methods to report health in communities.
I'd like to thank everyone for coming, and Dr. Jones, I know, or her panelists would be happy to answer questions after the session, and she has an email, kjones1@uchicago.edu.
kjones9@uchicago.edu. kjones1@bsd.uchicago. But thank you guys so much for coming by and for sharing with us our interest in community health. And thank you to the panelists.